Hi, this is Dr. Doug Willen, and today we're going to look at the thyroid, specifically signs and symptoms. I came up with 17 signs and symptoms that I want to take a deeper dive. And before we start with that, we're going to take a little overview about where the thyroid is and anatomically and how it functions in the body. So there we go, 17 signs and symptoms. And the thyroid is located here right in the front of the neck, okay? Let's go on to another picture here. So there it is. You can see the shape of it. It's a ductless alveolar gland found in the front of the neck, just below the laryngeal prominence, which is also known as the Adam's apple, if you have one. Is roughly butterfly shaped, looks that way to me, with two lobes, a left lobe and a right lobe, connected by an isthmus. And it wraps around the trachea. And I put up a little map because I first heard the word isthmus in middle school when we were studying geography. And isthmus is an island that connects two bigger land masses with the sea or ocean on either side. But in anatomically speaking, it's a little piece of tissue that bridges between two larger bodies, and that's why they call it the isthmus of the thyroid. It's just a little trivial note. It's not that important for what we're going to discuss today, but I thought it was interesting. And I enjoy studying the human body and the anatomy, and it's always fascinating to just look at some of the origins of how words are developed and why the etymology of a word is always interesting to me, but in this case, it's because of the anatomical structure. It looks like a little land bridge or isthmus. The thyroid gland is a vital hormone gland. It plays a major role in the metabolism, growth, and development of the human body. So not just metabolism. Everybody thinks of the thyroid gland with metabolism, and that is true, and that is the major thing, but also growth and development of the human body. It helps to regulate many body functions by constantly releasing a steady amount of thyroid hormone into the bloodstream all the time. Let's go into the next slide. The thyroid gland makes and stores hormones that regulate, now get this, the heart rate, blood pressure, body temperature, and the rate of which food is converted into energy. So these are vital things because think about it. There's that old saying, you are what you eat, right? And that's true. I like to say you are what you absorb of what you eat. But how about this? You are what you utilize of what you eat. So we're eating food not to, well, it's of course enjoyment in today's world, but the apple that you ate this morning needs to turn into hormones and tissue later in the day. It needs to energize and function and run your body. So we have to look at really that pathway. We consume food with, it doesn't matter if you're a human being or any type of living organism, the foods that you eat run and govern the way your body performs and functions throughout your lifespan. And the thyroid has a lot to do with how we produce energy from the food that we eat. And when your thyroid's off, there's going to be problems. So let's look at some of the most common signs and symptoms. One of the ones that come to mind immediately with the thyroid is fatigue. And one of the most common symptoms of low thyroid, the disease name is called hypothyroidism. But what we're going to talk about a little bit today is not so much the disease state of hypothyroidism, because some people will eventually get that diagnosis. But it's thought as many as 13 million people just in the United States alone might suffer from low thyroid, which is a functioning low thyroid that's creating signs and symptoms, as we're going to discuss, but not enough to get a positive diagnosis that puts you into the disease state that we all know as hypothyroidism. And what I'm trying to say is that there are millions of people that feel sick and tired all the time. They feel like they're underperforming in their health potential. They're not feeling as well as they can. They go get their yearly blood work or yearly physical, and it comes back not showing a problem. And they go through life miserable. Maybe in a decade or 2 decades, let's say you're 35 or 40 years old now, and by the time you're 65, you'll finally get that diagnosis where the doctor goes, guess what, we found it, it's in your blood work, you have hypothyroidism, the big classified disease, and now we can do something about it. Or you might already know that you have that. But the thing is unless you can dial it in and functionally perform at the highest level, whether you have that diagnosis or not, that's what I care about. I care about how you're feeling day to day, and maybe there's ways that we can tweak and perform. So you might be one of the people that are already on thyroid medication, but you still don't feel as good as you can. There's more that you could do through diet, exercise, and maybe additional supplementation that piggybacks onto your prescription medication. Or maybe you're someone that never comes up with that diagnosis, but by looking through these 17 signs and symptoms, you become suspicious that you might be on the verge of getting that full-blown diagnosis, or you're living in that limbo state where you're never going to get the diagnosis in the near future, but you know something's off. Because the thyroid, what's interesting about it, and I've been working with it clinically from a nutritional and natural perspective in my practice for 22 years, is that when the thyroid is off, even a little bit, even if you're within the normal range, but it's not in that pocket, that little gap in the middle where you're feeling great, it's enough to really ruin how you feel day to day. And that's why I'm so curious about working with possible borderline low thyroid, and that's why I don't want to call it the disease hypothyroidism for this specific video, because low thyroid is enough to knock you out of balance. Let's move on. Here it says one of the most common symptoms of low thyroid is feeling worn out. And that's what we'll hear people say. They say, I feel burnt out all the time. I feel worn out. I feel overwhelmed. I don't have the energy I used to have. It controls energy balance and can influence when you feel ready to go or if you always feel like taking a nap. Another big sign or symptom is weakness. So low thyroid hormone flips the metabolic switch towards catabolism. Now, I'm not going to go too deep into this, but catabolism is when our body is breaking down, and anabolic or anabolism is when it's fortifying or building up. So you're more in a catabolic state when your thyroid hormone is low. Catabolism, or when your body is in that breakdown phase, the degenerative breakdown phase, your muscle strength decreases, potentially leading to weakness. So if you're not just feeling it or thinking psychosomatically, you're like run down and you're feeling weak. No, you literally are weakened when your thyroid is off. 34% of low thyroid individuals get muscle cramps, even in the absence of recent activity. So yeah, I would expect possibly to get a muscle cramp when you are just did a big boot camp class or exercise or all these calisthenics. But what if you get muscle soreness and weakness and you didn't do anything recently? People with low thyroid often report that. Here's another big one, weight gain. When thyroid levels are low, the metabolism switches modes. Instead of burning calories for growth and activity, the amount of energy you use at rest, or your basal metabolic rate, which is what that is, decreases. So as a result, your body tends to store more calories from the diet as fat. So it's working against you. When the thyroid levels are low, you store more fat. That's the takeaway. Coarse, dry hair. As you can see in the picture, this woman has coarse, dry hair, and a lot of people with low thyroid complain that their hair has changed. So they used to have this beautiful, luxurious hair, and now it is feeling dry, coarse, almost like the fibers are just dried out and brittle. They break a lot. Other dry things, dry skin. 74% of low thyroid individuals report that their skin feels dry. Just like the hair follicles, Skin cells are characterized by a rapid turnover. So our hair turns over, it falls out, we regrow. It falls out, we regrow. Same thing with our skin cells. And they're also sensitive to losing growth signals from the thyroid hormone. So as we lose cells and replenish cells, this happens throughout our whole life. That's a good thing. But the thyroid releases signals to the cells of the body that tell it to regrow, replenish, and do it well. It's not happening when your thyroid's off. Hair loss. 25 to 30% of patients seeing a specialist for hair loss are ones that have low thyroid. 40% of people seeking help for hair loss, they're over the age of 40. So this will be worse for more often women than men, but women over 40 that feel like their hair is thinning or losing density and thickness possibly will have that low thyroid come up. And remember, you don't always get the diagnosis right away. You could wait decades. So low thyroid hormone causes hair follicles to stop regenerating, resulting in hair loss. This will typically improve when the thyroid issue is treated. So yes, you might get that diagnosis and you go on thyroid medication, you see an improvement. What if you're not one of those people that get that? And there are ways to work with it nutritionally, which I've done over the years. I actually make a thyroid product. I'll talk a little bit about it at the end of the video. I don't want to make it a big deal about my formulas as much as this information here, but I made a formula that I've used clinically for 20 some odd years of my practice with my patients, and I'm still in clinical practice. So this is something that not only am I talking about today, but I work in the trenches with people that have these concerns and are looking for natural ways to fortify their thyroid. Next one, sensitivity to cold. About 40% of low thyroid individuals feel more sensitive to cold than usual. Even when you're sitting, you're burning a small amount of calories. So just sitting and doing nothing, you're still burning calories. However, in cases of low thyroid, your basal metabolic rate decreases. So that thermostat is not where it needs to be in your body. It's depressed, reducing the amount of heat that you can possibly generate. This one I hear a lot. My mom has low thyroid. I've been with friends and family with low thyroid, and they're the type of people whose fingertips are cold, the tips of their nose is cold, there's two little patches on the tip of your buttocks that always feels cold. And if you are listening and you go, oh my God, I know what you mean, tell me that in the comments, because it's true. Even there's like these two little parts on your buttocks that gets cold. And your toes are cold, and you're the type of person that almost wears socks to bed, needs a sweater at the movie theater or the restaurant. You're the one that's always chilled. You're telling people, is the air conditioner on? Can someone please turn down the air conditioner? Because you feel that type of cold. Now, muscle cramps and aches, we talked about that, but literally your body can cramp more. So not only does it get weakness and fatigue and loss of muscle strength, but it could also turn into muscle cramps, where it cramps up at night. You can get calf cramps, you can get neck or body or backache cramps, and constant body ache. Here's another one, constipation. Doesn't mean everybody has all of these signs and symptoms, but as you're watching this, start to ask yourself, is this something for you? Maybe it's not the constipation, but you notice that dry skin, hair, nails, fatigue, muscle weakness. Start to draw your own picture. This is just an educational video, just to give us all ideas for further exploration. So, constipation affects 17% of people with low thyroid hormone. Like I said, it's not going to be every symptom because that means 83% don't experience this. But it's part of the picture that we're making up. Low thyroid levels put the brakes on your colon. And that's why it would do this. When your thyroid is off, your colon becomes more stagnant. It doesn't do what it needs to do, and it can underperform. And when it underperforms, you don't move your bowel. Depression. Now, I find this one a big one. The numbers bear it too, but 64% of women and 57% of men with low thyroid report feelings of depression. But I clinically have seen this more than that number. I never did my own stats, but I just have a personal feeling in 22 years of practice that I think it's higher to 80%. So please don't quote me on that. I have no data whatsoever. I'm just sharing my observations and something that just comes up a lot. People might not complain as much as that their fingertips are cold, is how low they feel in life and depressed. So I guess when I'm in conversation with someone during a session where I'm talking to a patient, if you ask them what's worse, the coldness in your fingertips or that you've been feeling incredibly depressed for the last 10 years. You see what I'm saying? So hypothyroidism and low thyroid is linked to depression. Irritability. So you could almost couple this with other emotional topics, but I'm breaking them down or unpacking them. And irritability is that kind of short fuse or feeling you can't cope as easy, or stress affects you to the point that you always feel like your nerves are shot and you might be more short in your reactions to people and events in your life. And that's unfortunate, but sometimes you see a difference. You start to balance someone's thyroid, they start to get a handle on feeling better, and they notice that they're less irritable. And their loved ones report back to them that they feel more easygoing and less stressed. Memory loss. Many patients with low thyroid complain of mental fogginess. They have that brain fog, is what people call it. Now, I know people that think so rapidly, they're so fast in their reaction, their wit, every part of their personality. But when their thyroid is off, they get a little sluggish. They're not as funny in their sarcasm, irony, and quick wit. They feel like they have mental fatigue and brain fatigue. Now, if you're still menstruating, or if you're on that borderline of where you're transitioning from being a monthly, having a regular monthly cycle to possibly starting to miss months of menstruation, moving into menopause, both irregular and heavy menstrual bleeding are linked to low thyroid. So if you feel like you're the type of person that's your blood flow is more clotty, more thick, it's heavier, instead of it being 3 to 5 days a month, it's now 5 to 7 or 9 days a month. It could be a multiple number of things, but low thyroid could be a component. So remember, I didn't say low thyroid's causing that. I'm saying low thyroid may be a component. And that's why clinically, when I work with patients over the years, we work not just with thyroid, but we look with natural progesterone creams, thyroid, adrenal, diet, exercise. A lot of things come to put together the picture or put together the puzzle that will complete the picture and have someone feel well. Thyroid hormone interacts with other hormones to control the menstrual cycle. And that's what I mean. It's not just one little facet, but it's something to consider. Abnormal levels can disrupt their signal and have them be out of balance. Couldn't find my word there. Didn't even find the best word, but couldn't find the right word. Also, thyroid hormone directly affects the ovaries and uterus. So there you have it. So thyroid hormone directly affects the reproductive organs, the ovaries, the uterus, and therefore will directly affect how our menstrual cycle, either normal or abnormal, will appear. Sexual libido. Often patients report a decrease in sexual libido when their thyroid is off. There you have it. Dry eyes. I could have put this with the other dry section, didn't think ahead, but the eyes can feel like there's sand in it. They're dry, rough, irritated. You keep grabbing your saline lubrication, but it seems like that becomes a part of your life because your eyes are always dry. Increase in allergies. Ringing in the ears. Now, this is a rare one. You won't see this in that many publications, but it is interesting because tinnitus, or tinnitus, however you want to pronounce it, tomato, which is that whooshing, ringing sound in the ears that's either faded in the background or very throbbing and present 24 hours a day, may have an underlying link to low thyroid or hypothyroidism. So that might be something to check. So if you get ringing in the ears, Doesn't mean this is going to be the answer. It means it's something that should be explored. In severe cases, which I really didn't want to even include in the 17 that I put up, but severe cases, and this is ones that would show up in your blood work, you would have severe hypothyroidism, you would get the diagnosis, and in severe cases you can see jaundice, extremely slurred speech, and sometimes the tongue is enlarged and swollen. Little blurb on myself. I create nutritional products. I have right now 14 nutritional products that I custom formulated. One of them is the, let me see if I can do that. One of them is Thyroid. These are formulas that I've worked with patients clinically over the years. And the website is Little Tree Nutritionals, which is also in the description section below the video. Please subscribe to this YouTube channel if you'd like. I'm going to be putting out a lot of videos this coming year on adrenal, thyroid, progesterone, hormone balance, longevity, sexual libido, different vitamins that should be in everybody's everyday diet that support wellness, longevity, and a higher quality of life. I also have a very active chiropractic channel. Like I said, I'm still practicing clinically, and you can find that on Instagram or on my other YouTube channel called the House of Chiro if you find stuff like that interesting to watch. Thank you for joining us today.